aging. That's the topic of this edition of Inside Indy. In fact, it's so important we talk about this. We've taken Inside Indy on the road. And joining me today is Megan Ebor, right?
Yes.
Welcome to Inside Indy here at the Indiana Minority Health Coalition offices, 3737 North Meridian Street. And we're so happy to have you here on Inside Indy.
I'm so happy to be here as well.
You are a filmmaker. You've put together a documentary,
yes.
Right?
Yes.
Okay. And the name of the documentary is?
The name of the documentary is Even Me.
Even Me.
Even Me.
Okay.
And, you know, I'm actually, my background is actually in social work. And I decided to tackle an issue that I saw in the field as being overlooked with older adults and sexuality and STDs. And so HIV and AIDS really stood out to me because the statistics were staggering, and especially in terms of ethnic minority older adults. So I wanted to really address the issue in a way that would be relatable to the community, and therefore I chose to make a documentary film.
Wow.
Yeah.
Okay. Well, about a million questions pop in my head.
Yes.
Because as I started off saying AIDS or HIV and AIDS and aging, people don't usually think of them in that same space. We think of AIDS as being, or HIV and being affecting young people.
Yeah.
Single people, gay people, that kind of thing. But you say no in this documentary. That's not necessarily
Absolutely
the only
not.
case.
Yeah.
Okay.
Well, you know, you have to really think about the history of the epidemic and how it was kind of put into the media and how media addressed it. You know, at first it was the gay white man's disease, and it was ravishing people, and the images that were portrayed in the media were very, very harsh and scary. But we had to. I really felt the need to address this topic at this point and at this time because the face of AIDS is changing. The face of HIV is changing, and it's impacting all communities. And we really need to address the stigmas and the taboos because it's no longer isolated to certain or particular communities. It's affecting and impacting heterosexual communities and particularly aging. Older adults. So
when you talk about how it's evolved, and I'm old enough to remember, and you probably are not, but when it hit, Ryan White, who is from Indiana,
right.
And it was a 14-year-old Kokomo kid in the school system, and of course he wanted to go to school. They wouldn't let him into schools, and what it was just like, people were just terrified of this disease.
Yes.
And I remember the morning he passed away because all the media, we were over at Riley Hospital for Children and waiting for, the end was near. And when he actually died that morning, of course, then there was a funeral here where Michael Jackson and Elton John. So I can remember the beginnings of it when I too even we all went through that, and how it has evolved where it's almost kind of, it seems like it's disappeared, but it's still very much alive. And as you said, in the aging population, take us there. And I know this is a part of your documentary, yes. And so we're not able to see all of that right here, right now, but take us there through your documentary to help us to see what we're not seeing about the connection between HIV, AIDS, and aging. Yeah. What is it that we need to know we don't know?
Well, you know, I feel because of a lot of the outreach and targeted prevention efforts have targeted younger people, that it almost gives the older adult the false assumption that they're not at risk.
Okay.
And so, and when you think about the usage of condoms, condoms are typically for prevention of pregnancy, and then second, so I don't get an STD, you know? So when you think about the population, it's like, okay, I'm no longer of childbearing age, so what do I need a condom for?
Right,
That's for the young ones, you know?
Okay, you're right.
So,
you're right.
And then what you also have to consider, you know, if you've been married for a long period of time and you lose your spouse either to divorce or death, you're gonna go out and you're gonna start navigating the dating scene again. So how do you do that? And what are the thought process of an older adult getting back into the dating scene? And I don't think that condoms or negotiating sex and those types of things go into that thought process because it was never an issue. So, so those are the things we really need to think about as an older adult when you get out into the dating scene. Just because you've known someone for 30 years does not mean that they are not infected, with HIV or AIDS. Go and get an HIV test. Providers also don't address older adults in terms of sexuality and aging. It's almost uncomfortable to have that conversation with your provider, which there are missed opportunities for prevention and education.
Okay. So when we talk about the aged, so what age are we really talking about? Because I'm going through, I think I'm in that group, but are we talking about 40 up, 45? Yeah. And who do you focus on in your documentary?
Now, so the documentary I focused on age 50 and over.
Okay.
Now, I don't think 50 is old. However,
I like you. I like this woman.
However, but I was going by the CDC guidelines. So the CDC, they're the way they do their research and for HIV and AIDS, 50 and older is considered the older adult population. So the film focuses on 50 and older, and there are 7 women and 1 man in the film that participated. And the film process, these women are so authentic and honest with their stories and courageous. I mean, I felt blessed being in their presence for them to have the courage to stand up and talk about their experiences in the way that they talk about their experiences. I mean,
Are they infected? Is that?
Yes.
Okay.
They are all HIV positive, and they talk through they go through the journey of their diagnosis, how they contracted the disease, and it's a riveting film, a must see, because I have never seen this population speak in the way that they speak, so free about a topic that, in their generation, you don't talk about sex, you don't talk about current sexual practice, and you certainly don't talk about HIV and AIDS.
Right.
Yeah.
So it's real. It's real. Do we know any statistics on those who are 50 and older with AIDS and how those might compare to the younger generation?
Well, my film really looks at the older adult population, 50 and older, and when you look at women, which most of the cast is women, 70% of HIV-infected persons in the United States, Latino and African American, are women over 50. And when you look at when you also look holistically at the aging population, by 2015, the CDC predicts that there will be 50% of the infected persons here in the United States will be over the age of 50.
Wow. So you have an aging population, and then you have those who are already there who maybe made it to 50 and were infected. It sounds like you're talking about 2 different groups.
Well, when you break it down, you have to consider that the antiviral medications are allowing people to live longer. So you have people that are aging into the older adult populations, but then you also have your new infections. And when you really think about it, the more you have, the more interaction that will take place, and the more the virus will be spread if we don't get the education and the awareness out that you are at risk regardless of your age, and that the aging population is being impacted.
Okay, Megan, hold that thought. We're going to take a break, and we'll finish this discussion when we come back. And we're back with Megan Ebor, who is behind the documentary Even Me, and we're continuing our discussion. Do you think the average 50-year-old goes into a situation, whether if they're dating someone or however they come into that, thinking that, oh, this isn't going to happen to me? What's the scenario, and what did you hear from the women, and the people in your documentary? How does it happen? How do they end up in that situation?
Yes. Well, you know, first I'd like to qualify that all of the women in the film are heterosexual. So that already gives you the point that it's not just happening to those people or to the gay population. And then we want to also look at the women in the film, some were infected by their husbands. So,
whoa, okay.
Yes.
Stop. Stop the tape. No, don't stop the tape.
Yes.
Really?
Yes, so, and I'll tell you, the making of the film, one of the ladies mentioned, she said to me in her interview, you know, women think just because they're married, they don't need an HIV test. And that couldn't be further from the truth. You know, we all have to take responsibility for our own sexual health. And it comes by speaking to your doctors, getting your annual visits, and if they are not offering an HIV test, you need to ask for an HIV test. And I think once we start to take away a lot of the embarrassment and the shame and the guilt that surrounds the whole topic of HIV and AIDS, that we will be able to openly discuss what's going on with us. I mean, this should be, an HIV test should be as simple as getting your blood pressure checked, you know?
Okay.
But we're just not there yet. And I think the more that we talk about it, the more that films are made like this, where we can really engage in rich dialogue within our communities, these opportunities will come to pass.
Is that more our fault or the healthcare provider's fault?
You know, I wouldn't fault anyone, but what I would do is say both parties are responsible.
Okay.
So, you know, the genesis of this film, it came, well, first my studies. I was studying, I'm a geriatric social worker.
Okay.
My concentration was gerontology. So I knew what was going on within these groups because academia. However, it was the personal story when this hit home for me with a relative of my own, whereas she was in her 80s. And she was, you know, suffering with some cognitive decline, and she was becoming combative and forgetful. And this relative was very on top of her health care, you know, annual visits to the T. She worked in the hospitals, you know.
Wow.
So the oversights that happened with my relative, she went to her doctor, oh, she's older, that's what happens, you're supposed to get forgetful. And, but no, you're not.
Right, not necessarily.
Not necessarily. And what we found out later on was that she had an undiagnosed STI that spread to her brain.
STI meaning?
Sexually transmitted infection.
Wow.
So that spread to her brain and caused this deterioration in her quality of life.
Get out.
Something completely that could have been treated with penicillin, you know? So, you know, having this happen within my home front and then with my studies coupled with that, you know, what do you do with this? This anger and frustration with the relationship between provider and patient. And so that's why I really decided to tackle the film and say, you know what, we have to develop a way to connect with the community. And I can hand out as many brochures as I want, but who really wants to read a pamphlet that says HIV or STDs or STIs? So I said, you know, I'm going to make a film, and I'm going to find the people who will talk about this, who will have the courage to be as authentic as they can be, and to really connect with the community so that people can look at the film, look on screen and say, that could be me. I can relate to that person. And so I took it on, and and I really feel that this is my ministry, and that this is a project that I could not have done in my own strength. There was divine intervention because I could not have planned it. I couldn't plan something like this. The film has been well received. The women in the film, I mean, they really tell it. They tell these stories, and I feel so blessed to know them, you know, and I've adopted them all. They're like my family. So it's just a blessing to be a part of it.
I want to talk more about their stories, but
Yes.
you really struck a nerve when you talked about the marriage issue and this happening to people when they're married.
Mm-hmm.
So, how's that happening? I mean, because most of us believe when we're married, that's one reason why a lot of people get married. Because it's like, I don't want to be out there in the street. I don't want to, you know, I'm tired of the running around the games.
Absolutely.
Or I want that security that I don't have to worry about that or those kinds of things. Yeah. And so you're telling me this is coming into a marital situation.
Yeah, well, first what you have to take into consideration is that not everybody gets married at 18, right? Okay. Not everybody gets married in their 20s. You may be divorced and you meet someone, but you have no idea what they have done previous to meeting you, you know? So you can have a fiance, you're about to get married, he could have had a history of drug addiction, maybe sharing needles. He could have had a history of, you know, he may have had one encounter with a person who was infected. I think
not necessarily a playboy, but
not necessarily a playboy. And I think it's very important to tell these stories because most people think, oh, you were sleeping around, you slept with 50 million people, and that is not the case. It takes one encounter with an infected person. Or another example that I came across was a family member who was a diabetic, and they ran out of supplies and shared a needle with a family member that was infected.
Oh, no way.
They did not know. So these are ways that defy a lot of the stigmas and the myths and the taboo. It's not this icky thing that you were sleeping around and you know you had all of these partners. It can happen to anyone.
It sounds like, and many times, it's just they're accidental even. Yeah.
Yes, and
not intentional.
Not intentional, and so that's why I feel it's important to empower people to take responsibility for their own health care. Get an annual test. You go to the doctor, and most people don't, but you should go to the doctor annually.
Right.
And when you go in, just say, hey, just test me for, give me a battery STD test.
Okay.
Just as simple as that. And if your doctor looks crazy at you, you look crazy back at him and say, I need the test. You know?
Okay. Have you found any of them or anybody to say that when they go to the doctor that you don't need that?
Well, what do you need that for? And some were like, well, why? You're married, you've been married to, and I think the more comfortable, like if you've seen your doctor for many, many years, you know, it's like, well, what do you need that for? And you feel this sense of judgment and shame. And I think that there needs to be more training in these areas for physicians and providers and social workers, the whole gamut, because this needs to not have the you know, just the whole cloud of darkness around it.
Okay.
It's okay, you know? Okay. Get the test, take care of you, be responsible for you.
Okay. I think the reasons people don't get the test is you don't want to know. I mean, you need to know.
Yes.
But don't want. Is that like the number one reason you think?
You
or
know,
what?
I can see how that could be an issue. Most people, it's like, if I have it, I don't want to know.
Or if life seems to be okay, I'm not sick, who cares? You know, yeah.
Yes, but you in the film you will see that there are a lot of women who talked about being infected. They had it in their systems for 10 years before they were diagnosed. Whoa. So the more time that passes by that you have the virus, it's spreading, it's replicating. It's like a copy machine. It just keeps going and going, and it's, you know, taking over your immune system. So it's time for us to man up, woman up, and just, it's better to know than to be in the dark about it. It's just better to know because there's medications you can get on that will keep you healthy if you adhere to the medication. But the longer time goes on, you know, the harder it will be to combat the disease.
Okay. We're going to take a break.
Yes.
When we come back, we'll talk more about I don't want to call them victims, the people in your your
Oh, they're
documentary?
champions.
Your champions.
You got to meet these women. They're
Yeah.
so not victims.
Okay, okay.
Yes.
In the documentary, Even Me with Megan Ebor. We'll be back.
Absolutely.
And we're back with Megan Ebor, who is behind the documentary Even Me, and about HIV, aging, AIDS, the older population. The women in the movie and the documentary, let's meet one and tell us what her story was and what she conveyed on the screen.
Okay. Well, you know, one of the stories that really was touching, one of the older women in the film, she's 73.
Oh, wow.
And how she talks about carrying condoms and how her children used to laugh at her for carrying condoms, and how one weekend she went back to where she was from. She was visiting her hometown, and a gentleman she's known her entire life, they reconnected, and they had gone out to a party, and they decided that they were going to be intimate, and she didn't have any condoms. And so she says, she rationalized this whole scenario and said, well, one time won't hurt. And one time turned into the whole Labor Day weekend, and she didn't find out that she was infected with HIV until 10 years later. And the dynamic of the family dynamic with her children, I mean, they put her in a nursing home, and they thought that she would infect the whole family if she came home, and she was in a nursing home, and
So she's ostracized.
yeah, the family dynamic became very turbulent. She didn't really have the support that she needed, and you know, it's not like that today. I mean, but it took 12 years of her being HIV infected to reconnect with the family. So there are still, even within families, this whole, you know, psychosocial dynamic that, you know, how do I love and embrace my family member that is HIV, you know, infected, or how do I love and embrace my brother, my sister? And I feel that her story really hits home for a lot of people, because if it's your family member, how will you react to that? How do you embrace and love someone through, you know, a difficult time with their health?
That's tough. And for those out there who might be watching who say, you know, I'm married, this isn't necessary,
Oh,
and you know, and you need to, you should be married,
Yes.
and this wouldn't be an issue. You say what?
I say that's bunk. I say that you never fully know. You never know 100% the person that you're with. You don't know their history fully. You never ever will know someone's full history. You know what they tell you. So if you're married, not married, get tested. Get tested together and look at the results. Don't let someone tell you what their results are. Because there have been cases where it's like, oh, I'm okay. I had the test. And then we find out that that's not the case.
Okay. And the documentary, Even Me, you're at film festivals everywhere, and people can find you on Facebook?
Facebook, yes. Even Me Film is the Facebook handle, and then my website is evenmefilm.com. So yeah.
Sounds good to me. Megan Ebor of Even Me, thanks so much.
Thank you very much.
For joining me.
Yes, thank you.
Here on
Thank you.
Inside Indy, I'm your host, Kelly Vaughn. We'll see you next time. Bye-bye.